Hi, my name is Darla Sarin. I'm a radiation therapy at St. Luke's in Liberty. I am here to tell you about the average appointment schedule for our patients. They are originally referred from their primary or medical oncologist or surgeon to come here and see the medical or the radiation oncologist that would see them and decide whether they were appropriate for radiation treatment. We would then, after that initial consultation, they would be chosen to receive a simulation for the area that they are being treated for. We would then bring them back for that second simulation appointment where we would conduct a CT sim. They come in, are checked in at the front desk, escorted back to our CT machine, and we have them lay on a table. Depending on the area that we're treating, would deem the equipment that we would use for immobilization. We have different options for that. We have backlock bags, head shells that would immobilize them for brain or head and neck cancers. We have different pieces of equipment, wing board and breast board, depending on if we're treating their chest, depending on how their breast would lie or how large or small they are, would determine those kind of equipment that we would use. We then mark the patient with a marker. They have X's that we would eventually, at the end of the treatment, tattoo the center of each one of those. It's a small, tiny dot tattoo that we give with ink and a hypodermic needle. We would then be finished with the simulation, send the patient on their way, and our dosimetrist, physicist, and doctor would come up with a plan, do the QA on that plan, make sure that everything is safe and appropriate, and then be able to call that patient back in to start treatment. The whole process for planning would take about a week and a half to 2 weeks, and then we would call that patient and be able to start their radiation. This is our CT simulator. We would have the patient lay on this table, which is normally a lot lower to the ground, raise the table up, and then we're able to bring the table in to line up to the area that we would be simulating. The different pieces of equipment that we would have are, this is a wing board. We would treat our breast, lung patients, anything thorax, ribs. This allows the patient to comfortably bring their hands up above their head, hold onto the handles, and then some wings on the side that would allow their elbows to rest out. We also have backlocks, which we would use for different areas, parts of the body. This one in particular is for our lower leg area. It starts out as just a bag full of BBs, little styrofoam balls. We hook that up to a vacuum after we've laid the patient into it, suck the air out of that, and it is able to lock off, creating a mold that we would use every day for their treatment. And they just rest their legs in that. By immobilizing their legs, then we're able to treat areas like their pelvis, or prostate, or bladder. Our colorectal patients might have this kind of immobilization. We also have different face masks that we would use. And these start out as just flat pieces of mesh. They have a system that locks them into a headrest system that would help immobilize them. We put this into hot water, which is 165 degrees. It then is very flexible, and the white part of this is very clear. And we're able to stretch this down over the patient lock it onto the table and let it cool off. It holds this shape, and then they're able to see through it. It's open on their mouth. It's easy for them to breathe through. It's custom made so it fits perfectly. It actually tightens up a little bit, which is what would allow them to hold still. This would be something that we would use for head and neck kind of cancer, possibly a C-spine. This is the exact same thing, except we would use these to treat our brain patients. Something where they don't need their shoulders immobilized. By the time we were done with the immobilization part of it, then we're ready to do the actual scan. We would scan just the body part that we're treating. This is not a total body scan. We normally do not use contrast, but sometimes contrast is involved with a simulation. By the time we're done with the simulation, the X's that we put on them would become the tattoos. And the equipment that we would use would just be a normal hypodermic needle and a drop of India ink. This is what a tattoo looks like. Very small, not anything that most of the patients notice, but allows a permanent mark that will not wash off. And then we're able to use that to get them in the same position each day for treatment. This is the console area where we would deliver radiation treatments. The therapist who is doing the driving for that day is able to monitor the patient on different screens that we have. We're able to pick the patient from our list that we have pulled up for our schedule for that day. And then we would pull that patient in and initialize their treatment for that day, the record and verify system. We also have another part of what we do back here. Some of our patients were able to use a surface monitoring system where we would be able to monitor breath holds for our left breast patients, and actually do a setup with this or perform a treatment with it also. The treatment machine, the room, has a door that we would use when the machine is actually on. The door has to be closed just to allow for radiation safety purposes. Come on into our treatment room. This is our linear accelerator. This is the only machine that we have here at Liberty. It is a true beam variant, and it allows us to treat IMRTs. We use it to treat SBRT patients when we're doing lungs or livers. We have a lot of equipment that's mounted up in the ceiling that allows us to use that surface monitoring system that we talked about. And we also have monitors that hang down that give us the different coordinates for the table and the pantry when we are treating. All of that information from the plan is loaded when we pull that patient in from our schedule. We have the table set up right now for one of our head and neck patients. We would have them lay down and then position them so that they're immobilized, and then line up to the marks that we've given them with our laser system. We would line the patient up, tattoos or marks in the center of the lasers, and then by bringing the table up and in, and after we've done that, then we would be able to take imaging with our machine. We have two different imaging devices. We can do a kilovoltage, a kV image, or we can do an MV image with the actual radiation that we would deliver for treatments. After x-raying the patient, making sure that they are lined up where the doctor has prescribed treatment, we would then go back out to the consult area and deliver the treatment. And then when that is done, it probably would take 10 to 15 minutes total. We would come back into the room, bring the patient out of their equipment and off the table, and it would be done.
Okay.
After the patient is laying on the table and we've lined them up with their immobilization devices, we would then raise the table up and bring the table in to line it up to the mark. So the tattoos that we've given them for their particular site of radiation. We use the hand controls to rotate the table. This allows us, the machine, to treat at different angles. We're able to treat with arc therapy, where during the treatment, the machine will consistently move all the way around the patient. This also allows us to line up the patient for imaging that we would do prior to the treatment to make sure that they're lined up properly. Everything moves with this handset, making it very